Thank you very much. I want to thank the American people for the incredible sacrifices that they're making on behalf of our nation. And I want to encourage everyone to keep following our guidelines on social distancing, avoiding large gatherings and hand washing and all of the other things that everybody knows they're supposed to be doing. Ultimately, the goal is to ease the guidelines and open things up to very large sections of our country as we near the end of our historic battle with the invisible enemy. Today, as you probably saw, the Dow surged over 2,100 points. That's the all-time record history of the exchange. This is very encouraging, and I think part of the reason is they are looking at what is close to being passed, and I think a very big part of it is they see that we want to get our country open as soon as possible. I'm also hopeful to have Americans working again by that Easter, that beautiful Easter day. But rest assured, every decision we make is grounded solely in the health, safety, and well-being of our citizens. This is a medical crisis. This isn't a financial crisis.
We now have 370,000 tests that have been done. The majority of those, over 220,000 in the last 8 days, which those of you who have been tracking the South Korea numbers, put us equivalent to what they did in 8 weeks that we did in 8 days. About 56% of all the cases in the United States are coming out of that metro area, and 60% of all the new cases are coming out of the metro New York area. Everybody who was in New York should be self-quarantining for the next 14 days to ensure that the virus doesn't spread to others.
The areas of the country that are not hotspots, that are not going through the terrible ordeal that New York and California and Washington State are going through, they still have a window of significant degree of being able to contain. In other words, when you test, you find somebody, you isolate them, you get them out of circulation, and you do the contact tracing. Understandably, people want to get out of New York. They're going to Florida, they're going to Long Island, they're going to different places. The idea, if you look at the statistics, it's disturbing. About 1 per 1,000 of these individuals are infected. That's about 8 to 10 times more than in other areas, which means when they go to another place, for their own safety, they've got to be careful, monitor themselves. If they get sick, bring it to the attention of a physician, get tested. We're also doing randomized clinical trials on a number of candidates. You've heard about candidates, but there are others in the pipeline where we'll be able to design the study, and over a period of time, particularly since we have so many infections, we'll be able to determine definitively, are these safe and are they effective? We're talking about remdesivir, other drugs, immune sera, convalescent sera, monoclonal antibodies. All of these are in the pipeline now, queuing up to be able to go into clinical trial.
The total package here comes to roughly $6 trillion, $2 trillion direct assistance, roughly $4 trillion in Federal Reserve lending power. Again, it'll be the largest Main Street financial package in the history of the United States. Liquidity and cash for families, small business, individuals, unemployed, to keep this thing going.
At this point, FEMA informs us today that they are distributing 7.6 million N95 respirator masks, more than 14 million surgical masks, and FEMA has already shipped 73 pallets of personal protective equipment to New York, 36 pallets of personal protective equipment to the state of Washington.
If you add it all up, that's probably 9 days plus another 2.5 weeks. It's a period of time that's longer than the original 2 weeks. So we're going to look at it. We'll only do it if it's good, and maybe we do sections of the country. We do large sections of the country. That could be too. But no, we're very much in touch with Tony and with Deborah on everything we're doing.
Who suggested
I
that
just
date?
thought it was a beautiful time. It would be a beautiful time, a beautiful timeline.
So that was
It's a
based
great
on
day.
any of the data?
It was based on a certain level of weeks from the time we started.
You can look at a date, but you've got to be very flexible, and on a literally day-by-day and week-by-week basis, you need to evaluate the feasibility of what you're trying to do. And you find, after a period of time, that there are areas that are very different from other areas of the country. You may not want to essentially treat it as just one force for the entire country, but look at flexibility in different areas. So I think people might get the misinterpretation. You're just going to lift everything up, and even somebody's going like that. That's not going to happen. It's going to be looking at the data.